Good evening, my dear friends. Welcome to this session of a quick, run through the different important topics of microbiology. So what we are going to do in this session is exactly like we will solve certain MCQs, and through that MCQ, we will, just brush up the concepts as such related to those topics. Okay. Now, this is definitely not a session where I'm predicting any question or anything like that. This is plain and simple, just a quick recap of the most important type of, topics that we should expect. That's all. Okay. Now, so welcome to this session, whoever is watching me right now. And guys, please keep participating. Like when I put a question, I want you guys to participate and let me know the answer, what you think is the correct choice. So let's not waste any more time. Let's begin. Wishing you all the very best. All right, here you go, the very first question. A 46-year-old male presents with severe headache and pyrexia. He has a visible rash on examination. LP shows protein levels whatsoever, glucose levels, white blood cell count is also given. The gram stain shows that the gram-negative diplococci was seen that ferments glucose. Which of the following is most likely causative organism? All right, looks like most of you have already answered, and the correct answer is the option D, as you guys have told me. So guys, why did we pick this answer? Why not pneumococcus or streptococcus pneumoniae, who is actually the most common cause of pneumonia? See, all of you have answered this question. I'm sure you are reading this question properly. See, the point is, first of all, whenever you talk about the things like headache, neck stiffness, so there are certain signs like Brudzinski sign or Kernick signs that are positive. They're hinting towards meningitis case. Now, actually speaking, the most common cause of meningitis is Streptococcus pneumoniae. But why did we choose the answer as meningococcus this time? Why? Because two things are mentioned here. Number one, the gram stain. Streptococci are gram positive and they are not gram negative. That means this word was highly important for us. Okay, it's gram negative. That means pink color organisms should be seen on gram stain. All right. Another thing that tells me, clinical point that tells me that this is Neisseria meningitidis, it is the presence of rash. I hope you guys remember this point, right? Rash is present mainly with meningococcus or Neisseria meningitidis. Now, please remember that Neisseria meningitidis is one organism that can secrete endotoxin, special point. And there are certain special syndromes associated because it can lead to a shock. Waterhouse-Friderichsen syndrome, the one that presents with bilateral adrenal hemorrhages, shock, etc. Now, coming to the treatment, as such, I'm sure you all know that the empirical drug of choice, that means when we don't know what is the cause of this meningitis, the drug that we generally give, it's known by the name of ceftriaxone, which is a third generation cephalosporin. Whereas when I know that this is Neisseria meningitidis, right, known as the definitive treatment, then the drug of choice for this guy, that is meningococcus, would be penicillin G. All right, this is the treatment I'm talking about. Okay, ceftriaxone when you don't know the cause of meningitis, penicillin G when you know exactly that this is Neisseria meningitidis. All right. And if you want to talk about the prophylactic drug that should be given to mass population, then the drug of choice is ciprofloxacin. Okay, a fluoroquinolone by the name of ciprofloxacin. All right. So this is it that we have to know in this topic as such. Here we go, the next question. An 88-year-old woman who lives in a nursing home has recently had a chest infection and is treated with amoxicillin. Shortly after the antibiotic course is complete, the woman develops abdominal pain, diarrhea, and a temperature of 39 degrees. All the other residents in the home are well. A stool sample is taken and endoscopy is performed. What is most likely the causative agent in this scenario? Now, I really hope you guys are not choosing the option D for the doomsday, because we are discussing micro today. But yes, whoever is answering the D for Clostridium difficile, that's the correct answer. Good job, doctors. Difficile is the answer here. See, this is the thing that you have picked up here, that they're talking about antibiotic associated diarrhea. Right? This is a case describing antibiotic associated diarrhea. So the agent associated is Clostridium difficile. It also causes pseudomembranous colitis, as we know. Now the points to be remembered with this agent is, see, any antibiotic technically can do that, but the common antibiotics to do this is actually cephalosporins, drugs like amoxicillin, ampicillin, and previously clindamycin. Clindamycin notoriously would cause this antibiotic associated diarrhea earlier. Okay. Now they may ask you this, what is the drug of choice that is given for this scenario, that is antibiotic associated diarrhea? Okay. The drug of choice for this currently is oral vancomycin. Okay. The current drug of choice for this scenario would be oral vancomycin. Now, doctors, you should remember something. Generally, vancomycin is given through parenteral route, but this is the only scenario where we give it through oral route, because the drug has to be locally present in the GIT. Oral vancomycin has quite poor absorption rate. So that's why the drug will stay in the GIT and fight the microbes in that exact area. So that's why oral vancomycin is preferred. For, recurrent cases and all, we can use a drug called as fidaxomicin. Okay. Next. A 75-year-old man with poorly controlled diabetes is diagnosed with otitis externa. He is treated with topical antibiotics by his GP for 2 weeks without resolution of signs or symptoms. He presents to the emergency department with increasing otalgia and marked swelling of the external auditory canal. On examination, the external auditory canal is edematous and slight facial symmetry is noted. Malignant otitis externa is diagnosed. Lab tests reveal gram-negative oxidase-positive organism. What is the likely etiology? I believe Dr. Rajiv sir might have done wonders, and this thing should be at your fingertips now. That's why such a big question. I can see you guys are answering within seconds. Great job on this. And probably you remember the trick I told you. If you get a big question like this, always read the last 2-3 lines. Probably you can answer just from that. Okay. Now doctors, yes, you guys are correct. Pseudomonas aeruginosa is the answer for this. Now please do remember that Pseudomonas aeruginosa is also the most common infection in the burn patients as well. Now here, gram negative means it's also going to be pink in color. And a very important test that you should remember, that this guy is oxidase positive. That means it imparts purple color. Oxidase positive means it's going to impart purple color. So let us remember something, doctors. What is the importance of this oxidase test? Technically, there are a lot of gram negatives, as we know. So when you do the oxidase test, you're kind of segregating the gram negatives into two types again. The members of Enterobacteriaceae who are oxidase negative, and the other gram negatives are generally oxidase positive. Example like Neisseria, Pseudomonas, Burkholderia, these are the guys that are oxidase positive. Alright, so let us just remember that point. Gram negatives are split into two again based on this oxidase test. Alright, and oxidase positive agents give you purple color. A 35-year-old IV drug abuser with history of rheumatic heart disease is admitted with fever, cough, shortness of breath, splinter hemorrhages, clubbing, Osler nodes, etc. An echocardiogram shows the evidence of severe tricuspid regurgitation, and there are two vegetations on the valve. The organism was found to be catalase positive, beta hemolytic. Which of the following organisms is most likely to be grown in blood culture? Alright. Now guys, the correct answer to this, it is Staphylococcus aureus. How do I know that this is aureus and not epidermidis? See, number one, the points that you have to keep in mind, they have very clearly mentioned IV drug abuser. Guys, didn't I teach you this? In IV drug abusers, the most common cause of endocarditis, it is going to be aureus. Another hint, aureus generally involves the right-sided valves like tricuspid valve. Alright? And what confirms that this is at least staph? Catalase positive, yes, that could be epidermidis also, but beta hemolytic. Who exactly is beta hemolytic, doctors? Aureus. So the correct answer to this here would be aureus. Let us remember that. Now, please do remember a couple of points. If they use the word like subacute bacterial endocarditis, you're supposed to answer Streptococcus viridans. If they say acute endocarditis, again you will use staph aureus as the answer. IV drug abuser, you will still choose the answer aureus. Native valve endocarditis, you will still use the word aureus. Okay. Prosthetic valves, that's where we are going to choose the answer as epidermidis. Alright. Although even in the prosthetic valve there is another cause, but we'll just remember epidermidis as overall cause. Next, let's have a look at certain important, images over here. Now guys, I hope all of you can easily identify that if you see bubbles, I have explained to you that it is going to be catalase positive. The reason bubbles are seen is the function of this enzyme catalase, it is to break down hydrogen peroxide to water. Okay, it is to break down hydrogen peroxide to water. So if an organism has this enzyme catalase and you put it along with hydrogen peroxide, it is going to break it down producing water. So catalase positive is staph, catalase negative is strep. And what you see on the right side, I'm sure you understand, because of the formation of coagulum, right? This is the coagulase test. Coagulum, when you tilt the test tube also, you're not going to see the free flow of this fluid. Coagulase negative, there is no coagulum. That's why you can see the liquid flowing like this. Whereas coagulase positive, you will not see that flow. That's a coagulase test confirmative of Staph aureus. Negative coagulase test result, the organisms are known as cons, as you know, coagulase negative staphs. And guys, this is just a recap. Like you can see here, this is the gram stain of Staph aureus. How do I know if it's staph or not? Number one, this purple color first of all tells me it is gram positive. Round shape tell me it is coccus. The round could be staph, could be strep. How do I know this is staph? Clusters, grape-like clusters. If you see the organism in, this is going to be staph. Whereas if you see the organisms in chains, that guy is streptococci. Okay. I'm sure the size of the question has increased your heartbeat. All right. See, generally the exam doesn't give you this big of a questions, at least for microbiology. This is just for our practice to, gain info about different things right here. That's all. So, a 6-year-old boy is brought to the GP by his parents. He has been experiencing a dry cough with coryzal symptoms. On examination, there is evidence of conjunctivitis and an erythematous rash on his forehead and neck, which is confluent. Oral examination reveals red spots with white center on the buccal mucosa adjacent to the lower second molar tooth. He is currently apyrexial, though his parents state that he has been feverish over the past 2 days. His heart rate is 80 beats per minute. No one else in his family is unwell, though his brother did have chickenpox earlier in this month. What is most likely cause for this presentation? Now I know guys, like there would be some gap between when I say the things and then by the time you guys are able to see it through the streaming. But to my surprise, despite the questions are so huge, right? You still are answering the questions within seconds like this. That shows the confidence, right? I really want to appreciate you guys. You guys are doing amazing, amazing. Okay? You're going to literally fight this exam like Spartans, like how the Spartans did. Let us all do that. So now the answer to this, exactly as you guys said, it is going to be measles. How do we know that this is measles? Everything has been mentioned. You guys remember the 3 C's of measles that we have learned? The 3 C's of measles were cough, coryza, conjunctivitis. And they have mentioned all those things inside here. They had also mentioned the buccal mucosa, right? They had also mentioned about buccal mucosa, Koplik spots. So that's it. You have to remember these points over here. And the next thing, please do remember a rare complication but a fatal complication here. It's called by the name of SSPE, subsclerosing panencephalitis. This is a member of paramyxoviruses. Remember, measles come under paramyxoviruses family. The infective period of measles is 4 days before the onset of rash to 5 days after the onset of rash. If you compare it with the German measles infective period is 7 days before the rash to 7 days after the rash. All right. So this is the difference between the measles and the German measles. And lastly, in the diagnosis of measles, you should remember these cells called as Warthin-Finkeldy cells, right? I'm sure you guys remember this. Warthin-Finkeldy cells, which are multinucleated giant cells, right? So this is all about the topic called as measles. With measles, you have Koplik spots that starts 2 days before the onset of rash. See, rash comes on the 4th day in measles, right? After the onset of fever, the rash comes on the 4th day, right? And before the 2 days of the appearance of rash, you're going to see Koplik spots. Next is Forsheimer spots, which are seen in German measles. They are seen in the palate or the uvula region. Those are the Forchheimer spots seen in German measles. An 8-year-old boy is admitted to the hospital because of marked shortness of breath, a rash involving erythematous macules with a central clearing on the torso and extensor surfaces of the limbs, and bilateral swollen and painful hips and left knee joint. He is also febrile. The chest radiograph is performed which shows cardiomegaly, alveolar edema and upper lobe venous diversion. Despite aggressive treatment, the child passes away after a few days in the hospital. Which of the following is most likely present in the recent medical history? Okay. So as per you guys, the most popular answer here seems to be pneumonia. Okay. So what you guys told as the answer is pneumonia. In fact, majority of you chose that, except I see Dr. Vishal, Dr. Sweta, right? And few of you are choosing the option D. All right, let me teach you this case scenario. All of you, please see here. This is actually the diagnosis of rheumatic fever. Okay, this is a case of rheumatic fever. Is that clear? What are the things that tell me all this? See, number one, if you see here, young boy, right? Young children are the one that are affected by rheumatic fever. They're talking about a rash and they're saying this rash has a central clearing. That means this rash is like this, where the center is all clear, nothing is there. What is the name of this rash? Can you guys answer over here? I'll just write the first word since it is red in color. It is known as erythema. It's known as erythema. All right, it's called as erythema marginatum as you guys are typing in here. See how to remember this, dear friends. Only the margins are red. It's called as marginatum. Erythema marginatum. I hope you guys recall all this. This is all part of your Jones criteria. What is the J in the Jones criteria? Joint inflammation. The O should remind you the heart becoming big because of the itis, because of the inflammation of the heart. Next, the N stands for nodules which are subcutaneous, right? And for nodules which are subcutaneous. Next, E stands for this rash, what I'm showing you right now, erythema marginatum. And the S stands for a neurological issue called as Sydenham's chorea. So all these things are nothing but describing the Jones criteria. All right. And you know, there is some titer by the name of ASO titer also that we talk about as such with rheumatic fever. So I hope you guys relate and remember this clinical scenario over here. Now what I want to just explain with you is this: group A streptococci or Streptococcus pyogenes. Okay, I'm sure you recall the microbiology properties of this guy. They are the beta hemolytics. They are the beta hemolytic, streptococci that produce yellowish tinge on the blood agar. So group A streptococci. Now, what are the diseases that are actually caused by them? Let us remember the first two basic infections that can be caused by these guys. One is sore throat, that is pharyngitis. Sore throat, that is pharyngitis. So I told you this mnemonic. Remember, strepsils are for the sore throat. The strepsils are called strepsils because streptococcus is the cause for pharyngitis, right? So sore throat is the primary infection. Next, sometimes some, skin infections or soft tissue infections can also happen. Skin or soft tissue infections can also happen. All right. Now, what happens later on is, due to something called as molecular mimicry, there are certain big diseases which come as complications. Now, the big diseases that come as complications, one is rheumatic fever. Please remember, in the history of rheumatic fever, you will always have pharyngitis. All right. And another complication that can come is PSGN, post-streptococcal glomerulonephritis. This is the one which is a nephritic syndrome that presents with cola or dark colored urine, right? Chocolate color, cocoa color or cola colored urine. PSGN, post-streptococcal glomerulonephritis. And this PSGN could have a history of pharyngitis or skin infections, right? So this is the idea that you have to have. And another important infection that is caused by this guy, it goes by the name of scarlet fever that presents with the strawberry tongue. So that's with group A strep. Next question, there you go, guys. A 72-year-old woman presents to a GP complaining of unusual painful sensations affecting the left side of her trunk, which later progressed to a painful vesicular rash. There has been a mild fever and feelings of malaise during the preceding few days. On examination, she has a well-demarcated vesicular rash that appears to affect only one portion of the left side of her trunk. You know, the blood picture with certain things is shown here. All right, I'm already getting the answers over here. The answer is Varicella Zoster virus. The answer here would be Varicella Zoster virus. Good job on this, guys. I'm reading your options. You guys are doing pretty great. So Varicella Zoster is the HHV3 as we know about. And guys, this is the agent that can cause chicken pox in childhood and shingles during adulthood. Excuse me. So chicken pox is a bilateral rash, whereas shingles is unilateral. I told you it may generally involve a single dermatome like this. And the key to remember this very easily, I've always told in the class, shingle is single, right? It's unilateral rash. Next, this is just the picture of shingles rash. And when you zoom in, it is more of a vesicular rash, as you can see. Chicken pox, on the other hand, right, generally by the time you see them, they're going to be all flat lesions, okay? An 18-year-old girl presents to a GP with discharge. On examination, a thick cottage cheese-like discharge is visualized. She insists there are no other symptoms. Lab examination revealed organism with presence of pseudohyphae and Raynaud's broad test. What is the most likely diagnosis? Good job. Pretty much everybody is answering correctly. So, guys, when we talk about discharge, there are many people who will start thinking about things like trichomonas. Okay, you may think about gonorrhea. You may think about bacterial vaginosis. So, I've intentionally put all the options pretty much over here. Okay. Now, please remember something. Even if you don't know the pseudohyphae, Raynaud's broad, etc., There was one word that was given, just like in a plate. So they served you the cheese with a plate, right? So cheese-like word tells you that this is clearly, okay, Candida. This is going to be Candida, cheese-like discharge. And what confirms that this is Candida? The hyphal forms are generally from the fungi. So presence of pseudohyphae, because it's an example of a yeast-like fungus, right? So this confirms that this is Candida albicans. Not just this, the Raynaud's blot test, which is also the germ tube test, right? It's known as germ tube test. You may remember, right? This is how the germ tubes look like. Okay. So this is the thing that you have to recall for Candida. Alba means white. And guys, one more lesion that you can see on the tongue is called as oral thrush. Okay, it looks exactly as if there is some cheese on the tongue. That is oral thrush. Okay, next, let's move on. A healthcare assistant presents to her GP for a routine checkup. She states that she has received a needle stick injury at work over 1 month ago. However, she never reported this to the occupational health as she felt the patient to be low risk. She is now wondering about her infection status. Viral serology is undertaken. Which of the following most accurately reflects her hepatitis status? All right, there you go, you have the answer. The answer to this is vaccinated, that is the option C. This is the correct answer. This person is vaccinated, and how do we know this exactly? Guys, I'm sure you recall from our classes, I've told you that if you find only one antibody in a person, that is anti-HBs, probably that person was exposed only to HBs. Then how is it possible that you're only exposed to one antigen of hepatitis? That is through vaccination only. Otherwise, if this person had chronic infection or recovered case, you would see all the antibodies. Okay. Now, let me just show you this quickly. Please understand the difference here. Imagine this is the virus. This is the complete hepatitis virus known as the Dane's particle. It is going to have 3 antigens, SEC. Whereas if the person is taking a vaccine, in that vaccine you should understand there is only one antigen present, that is S. Now the point is, if you naturally got infected with hepatitis, you're going to get, infected with the first one over here, that is with this agent. So naturally, your body is going to start forming 3 antibodies over here, right? Your body will start forming 3 separate antibodies over here. So anti-HBs only appears, let's say, when you are recovering or recovered. So anti-HBs is seen, that means the person has recovered. Let's just assume that. Other antibodies are also seen if you're a recovered case. That means 3 antibodies should be found if you're recovered. Whereas if you find only one antibody, then that is a vaccinated case, because only one antigen is present in the vaccine of Hep B. Okay. Now there was a trick I told you always how to solve this kind of questions. Your priority is always to look at the first thing, that is HBs antigen. Doctors, if you see, right, this antigen, HBs antigen, you should say the person has hepatitis. The person has this disease, hepatitis. Okay. Next, if you see the antibodies present against this, there are only 2 scenarios. Either the person is vaccinated or the person has recovered. Second place you should go is, once you know the disease is present, you should have a look at anti-HBC antibody. If you look at anti-HBC antibody, you come to know whether the infection is acute or chronic. Why? Because there are two types, IgM or IgG. If it is IgM, you will say it is acute. If it is IgG, you will say it is chronic. And third thing you may have to decide is, if you look at the third antigen, that is Hbe antigen, this is the third place you should always look. This tells you whether the person is more infectious or less infectious. If this antigen is present, you should say the person has high infectivity rate or the person is highly infectious. If the antibody towards this is present, then you will say the patient has less infectivity rate or the person is less infectious. So that's it. If you see HBS antigen, you should say hepatitis is there. Anti-HBC IgM is present, you will say now it is acute hepatitis. Then you look at Hbe and decide whether the person is, highly infectious or less infectious. I hope this was, a quick explanation and help you recall the concepts what we have learned earlier. Now, next question says, a 7-year-old child is brought to the emergency department with difficulty breathing and a low-grade fever. Physical examination reveals a grayish pharyngeal exudate, enlarged cervical lymph nodes, and edema near the neck. Bacteria isolated from the exudate demonstrate toxin production. What is the test that is done to demonstrate the toxin? Good job again. So, as I see, most of you have answered this already. I'm quite surprised by the speed you guys are answering. Good job, good job. That means you have already made the diagnosis that this is a case of diphtheria. How did you do that? Number one, you could see this exudate, right? Next, you see this edema near neck. What is this edema near neck called as? Bull's neck appearance. This is known as the bull's neck appearance, right? The dirty gray membrane, the bull's neck appearance, everything just clinically itself is telling you this is diphtheria. All right. Now the points that you have to remember as such, okay, there are quite a lot of things to be remembered with diphtheria agent. Before I get into that, just I want to quickly run through the 4 options. Guys, Naegler's reaction, it is done for the toxin of Clostridium perfringens. Remember, lecithinase, the one that causes gas gangrene. Mecfedine's reaction, it is a test for the capsule of Bacillus anthracis. Elex test, as you guys answered, is done for the toxin of diphtheria. And Quelling's test or Quelling's reaction is also for the capsule of organisms, right? Now, let's just have a look at the recap of these pictures. The first picture, I'm sure you have seen it several times by now. This should be imprinted in your mind. The second one, I want you to remember, this is the potassium telluride agar. The best one for the isolation of diphtheria, potassium telluride agar with that black colored colonies, what you see. The next one is Loeffler serum slope. On this, the growth of diphtheria is faster. So you can expect the growth in around 6 hours, right? 6 to 8 hours on this Loeffler serum slope. Although this is faster, but the better one for the isolation is actually potassium telluride agar. Now the last picture I'm sure you identify, this is nothing but the Albert stain for staining of these granules, energy granules called as metachromatic granules or volatin granules or Babe Ernest granules. Okay, Albert stain is used, but although Albert we are using here, there are other stains also like Ponder or Nicer. So totally you get 3, pan mnemonic, Ponder, Albert and Nicer or NAP, however you want to remember. These are the stains that are used. you get this Chinese letter appearance over here. Okay, Schick's test is done for the, immunization. It was done, not anymore, to check the susceptibility of a person to diphtheria, Schick's test. So many things to be recalled as such with diphtheria. Lastly, since we are talking about the toxin of this agent, how does the toxin of diphtheria works, my dear friends? It inhibits protein synthesis in humans, right? So this guy inhibit protein synthesis in human beings. So we said, how does the bacteria inhibit protein synthesis in humans? Either by interfering with ribosome, like 60S ribosome, or by inhibiting the elongation factor. Elongation factor. I gave you this mnemonic to be remembered, CDEF. Remember this mnemonic, guys. Okay. Corynebacterium diphtheria works on elongation factor. That's how we had memorized this. Okay. So that's all that you should know as such with this topic. Looks good. Now, going ahead, a 3-year-old, child comes to the physician because of a rash as shown in the image. Okay. Should have been 30-year-old actually. The rash is not painful but does feel warm to touch. Which of the following agents helps in transmitting this infection? All right. The correct answer to this is exodistic. So first of all, what is the lesion that is actually shown over here represents? Guys, this is the bullseye lesion. Bullseye lesion known as Erythema migrans, right? Erythema migrans. This is the bullseye lesion. And now we are talking about the agent Borrelia burgdorferi here, the causative agent of the disease known as Lyme's disease. This is the lesion seen in Lyme's disease and it's called as bullseye lesion or erythema migrans. And please do remember one more feature, Bell's palsy. So I had asked you to remember in Lyme's, what do you see, doctor? Bull and bell, bull and bell. So there you go. That's the one. So Borrelia burgdorferi is the agent over here. And guys, please do remember this Borrelia and another agent called as Babesia, the one that causes malaria-like disease. Borrelia and Babesia, both of them are transmitted by the same tick called as Exodus. So all the B's we will stick together in our mind. Borrelia, Babesia, bulls, bells. All right. We have to use tetracyclines like doxycycline in the treatment of Lyme's disease. Now guys, dermacanter. Dermacanter is for a bug called as Francisella. Okay. Francisella tularensis, the one that causes tularemia. Okay. Tularemia generally spreads by, certain animals like rabbits, okay, deers, etc. So that's the one that is dermacanter. Xenopsella chiopis, it's a flea, it's not a tick. Xenopsella, it's a flea. And you may recall that this is the agent that spreads plague. Xenopsella is a vector for plague. And who's the causative agent of plague? Yersinia pestis. And lastly, sandfly. Sandfly is the important agent for a disease called as Kala Azar. And guys, you should remember Kala Azar, the agent is Leishmania donovani, the one with LD bodies if you recall. Okay. An outbreak of waterborne gastroenteritis with a high mortality was reported in India. It is caused by oxidase-positive, gram-negative rods with darting motility that grows well on alkaline media. Which of the following is predisposing condition for developing this disease? All right, friends. Now, what is these things that they are describing here? Waterborne gastroenteritis meaning fecal-oral route, right? Oxidase positive agent, gram negative agent, and shows darting motility. See, one word also you remember from this entire things, right? They all come in different topics. You should be able to first at least diagnose what this is. So this guy is Vibrio cholera, right? Or Vibrio cholerae. Darting motility is shown by Vibrio cholerae, all right? And these agents are oxidase positive and they are also gram negative, okay? And these are the guys that are going to grow well on alkaline medias. Please do remember that point, okay? Alkaline media. So what is the core thing that you should remember as such here? First, this diarrhea is actually caused by the toxin, right? How does the toxin of cholera works? It increases the substance called as cyclic AMP. It increases cyclic AMP. And I told you increase in this cyclic AMP is going to produce a watery diarrhea. That's why you see rice watery stools in this disease. Okay. Now, one of the predisposing factors, all right, is decrease in the acidity. Decrease in the acidity. Now, this could be due to either achlorhydria, or this could be either due to gastrectomies, or this could be even due to using drugs like, PPIs, etc. Example being omeprazole. Omeprazole. I just wanted you to keep this link in your mind. I'm not saying this is like a super high yield question. See, all I wanted you to read the question, remind yourself of the properties from Vibrio cholera. That's all I'm doing over here. Okay. So patients using omeprazole, this should be the answer for this. All right, doctors. That's all. That's about Vibrio cholerae. Okay. Please do remember that string test that we have talked about. A 40-year-old tourist male from Ecuador presents to the gastroenterology department because of difficulty swallowing liquids. He says he also has difficulty in belching. Physical examination revealed swelling of the eyelid and a rash. Barium swallow shows a dilated esophagus. Manometry confirms absent peristalsis in the smooth muscle portion of esophagus. Which is the most likely agent causing it? All right. So guys, the keywords in this, there might be a reason they have mentioned this word Ecuador, that is South America, right? Or in short, America. So what you have to remember over here, they're presenting with something GI complaints, right? What you see is swelling of the eyelid, okay? Swelling of the eyelid. You may remember words like Shagoma, the swelling at the entry point, Romana's sign, all right? And then they're describing mega esophagus, etc., myocarditis. So many things happens in this, right? So what is this disease that they are actually talking about? Where everything is kind of becoming big. This is the disease called as Chagas disease. And Chagas disease is known as American trypanosomiasis. And Chagas C4C, it is caused by, Cruzi. Whereas the other agent is brucei, the one that causes sleeping sickness, the vector being CC fly. Okay, in the sleeping sickness, this vector is CC fly. And who's the vector in Chagas disease? It is red in color by the name of reduvid bug, right? The name of this agent here is reduvid bug. All right, there you go. Good job on this as well. A 35-year-old male presents to the emergency room with progressive difficulty over the last 2 days, accompanied by tingling in his feet. Physical examination reveals decreased muscular strength in his bilateral lower extremities with absent deep tendon reflexes. His review of systems and past medical history are unremarkable except for a bout of diarrhea 2 weeks ago that resolved spontaneously. Lab test shows the organism is microaerophilic and grows on Skyros agar. Which of the following agents is most likely to be associated with this patient's condition? Okay, so I'll go ahead now. The correct answer to this is Campylobacter. Okay, so how do we know that this is Campylobacter? See, they have mentioned a diarrhea. All right. Next, they have mentioned the agar for the Campylobacter, Skyros agar. They have mentioned this word that is microaerophilic. See, Campylobacter or the bacters, they are microaerophilic. They are capnophilic, they like carbon dioxide, and they are thermophilic, they like higher temperatures. Okay, so 3 philic words are with Campylobacter. And I'm sure, obviously, since you answered this question correctly, they're talking about this syndrome called as Guillain-Barre Syndrome, right? The ascending paralysis. They're talking about this Guillain-Barre Syndrome, that is ascending paralysis from the lower body, right? Tingling in his feet, etc. What you're talking about. Although the Helicobacter is also microaerophilic, but that guy is associated with peptic ulcer disease. Okay, that guy is going to cause peptic ulcer disease. That's all that you have to remember. Cholera causes watery diarrhea, whereas Campylobacter can cause inflammatory diarrhea, which can be bloody in nature. Next, the shape that you should remember with Campylobacter is this seagull appearance. Okay, remember that bird-like appearance? This one, a curved rod, is going to give you this appearance known as seagull appearance. All right, doctors? Now, this is quite easy. An outbreak of hepatitis in West Bengal has happened. It was characterized by high incidence of fulminant hepatitis in pregnant women who experienced a mortality rate of 20%. The organism responsible for the outbreak is. All right. I'm sure you guys have already figured out that I'm talking about hepatitis C. That's quite easy. I know you know this. So, first thing, is hepatitis E transmitted parenterally? The answer is no. It is transmitted by fecal-oral route. Is it associated with chronic hepatitis? The answer is no. The ones associated with chronic hepatitis are B and C, and especially C, right? Maximum chronicity would be seen by C. Oncogenic properties are again by B and C, not with hepatitis E, right? So E is the dude that we have diagnosed over here. And lastly, it is a naked virus. We all know it's a non-enveloped or a naked virus. Hep A and Hep E, both are non-enveloped or naked viruses. It belongs to the family Caliciviruses, as we know. What is the interpretation for the result shown in the rapid antigen test over here? Okay. Now here I am getting assorted answers. I've gotten everything ranging from A to D. Some of you are typing Z also. So all the English alphabets I can see. All right, great. So let's discuss this once. All of you please look here. You guys are having no control. Okay, let's see. Number one, dear friends, when you are looking at a rapid antigen test like this, what you always have to keep in mind is before testing, see this thing what you see is the place where you're going to put the sample, patient's sample. Okay, control line should always be present. Before you look at the test line, the line on the control should always be present. Is that clear? So in this test, the control line is not present. So whether the test line was, seen or not seen, that doesn't matter. This test is invalid. This testing kit is invalid. Based on what? Because the control line was not seen. If control line is seen, then the line comes on the test or not, that decides. So suppose we will assume control line was seen. Let us assume the control line was seen like this. And now the test, here some line is coming. This tells the person may have COVID. It's not a confirmatory test, right? RT-PCR is going to be the confirmatory test. So all I'm saying, first you should always see there is a line on control or not. If line is present, the test is valid test. Now look at the result. Excuse me. So if you look at the result, test line is seen, you will say the person is positive. That's all. If the line was not seen, we will say the test is negative. All right. So if you see now, if I omit everything, this guy did not have a control line. That means this test is considered as, okay, invalid. All right, dear friends. All right. I'm sure you will break the record of even the speed of light now. What is this test shown in this image? All right. This is the Elex test, as you all know about, right? What is this full name for this? Elex gel precipitation test, right? It is an example of gel precipitation. In fact, these lines, what you're seeing over here, they are known as the lines of precipitation. Okay, I have explained this to you earlier that the first one and the third one is the control, right? The first one is showing you these 4 lines like this. That means it is a toxin producing stain. If you see a toxin production is seen, you will see this line X. X means danger. Let's remember it like this. The bottom one is also a control, and it is a known sample that does not produce toxin. That means the third one is a non-toxogenic strain of diphtheria. That's why that X line is not seen. So you just have to see the middle one, that is the one from the patient. If the X line is seen, you will say the person's sample is producing the toxin. If that line of X is not seen, you will say the patient's sample is not producing toxin. The whole motive of doing this Elex test is to figure out the sample from the patient, is it a strain of diphtheria that produces toxin or no? How do you know? See the X in the middle. If you see the X, toxin is produced. If you don't see the test, toxin is not produced. All right, so that's the end. That's my hint I can give you right now. Just like you had Wakanda forever, we'll say Elex test forever. Next. The egg shown in the image belongs to. Now, I hope you guys have identified this. This egg, what you're seeing over here, belongs to tapeworms. Okay. How do you recognize this egg that belongs to tapeworm? You can recognize it by looking here. It will contain this 3 pairs of hooklets over here. Okay, it will contain 3 pairs of hooklets over here. So this tells you this is an egg of a cestode or a tapeworm. Okay, this is an egg of a cestode or a tapeworm. And in the end, if you see something like this known as polar filaments, same egg but with 2 additional things, as you can see, called as polar filaments. Now this would be called the egg of H. nana, Hymenolopus nana, alright, which is also a tapeworm. Dwarf tapeworm is H. nana. Alright guys, so additionally if you see polar filaments, then you will call it a egg of H. nana. Is that clear, doctors? Next, how do you know, right, if the egg belongs to trematodes or flukes? Trematodes or flukes. Trematodes or flukes, they are going to have the eggs called as operculated eggs. Operculated egg means this is an egg like this that will have a line on the top, and this can open like a lid, right? It can open like a lid. So this would be known as a operculated egg. So all trematodes or flukes, they are going to have operculated eggs except, okay, except some flukes called as schistosomes or schistosoma. Schistosoma is an exceptional trematode or a fluke, right, blood fluke, that does not have operculated egg. So what exactly does this schistosoma have? It can have 2 things. One is spine, depending on whether it is hematobium or Manzoni. Manzoni has a lateral spine, hematobium has a terminal spine. And the species called as Japonicum, it is going to have a knob. Okay, Japonicum doesn't have a spine, long spine like this. Instead, a small dot like thing called as a knob would be present. Is that clear to all of you? Next, guys. The following culture media is an example of. So first of all, guys, you have to identify what this culture media is. This is a chocolate agar. Okay, this is a chocolate agar. Chocolate agar is nothing but lysed blood. Chocolate agar is a lysed blood agar. So first of all, let me just quickly go over the culture media. Listen carefully. Simple or basal media, as the name says, they are very simple media. Not every organism will grow on that, right? So only the non-fastidious organisms, meaning the simple organisms, grow on simple media. Now, to a simple media, when you add something, when you enrich the simple media with something, it's called as a enriched media. For example, to a simple media, when you add blood, now blood has been added, it is enriched with blood, it's called as enriched media. If you add serum, for example, Loeffler serum slope we studied for diphtheria, serum has been added, that's a enriched media like that. So I hope you understand when you add something like serum, egg, blood, right, that becomes a enriched media. It's enriched with something. Enrichment media, it's a liquid media for selective growth of organisms. Enrichment, I repeat, it is a broth, it is a liquid which is used for selective growth of organisms. For example, selenite F broth or tetrathionate broth. This is used for Salmonella, Shigella, etc. These are the right selective media for these respective guys. Same way, now the final one is selective media. The only difference between enrichment and selective media, selective is solid, enrichment is liquid. Transport media, I'm sure you guys remember. It is used to keep the sample viable for a longer period of time, but the organisms do not multiply in this. In transport media, organisms do not multiply. Example, Carey Blair, right, VR media, Pikes media, they are all transport media. All right, so that's it. Next. The organism shown in the image is associated with the following lesion. Now, dear friends, this image, what you're seeing over here, it is nothing but dark field microscopy, right? Dark field microscope has been used over here, right? That is showing you this spiral agent like this. And please remember something here. Who's the spiral agent that I'm talking about here? Treponema pallidum, right? The agent over here goes by the name of Treponema pallidum. Treponema pallidum, you all know, causes syphilis. Now, why are we not gram staining this agent? Because, it's difficult to stain this agent. That's why the better way is to use the dark field microscope. Since the agent is spiral like this, when it moves, it shows something called as corkscrew motility. It shows this thing called as corkscrew motility. I hope this is clear, doctors. Now, what are the main two lesions as such that you should remember with syphilis? In the primary stage of syphilis, you have this thing called as chancre. The correct answer for this is chancre. So this is a painless thing that is seen on the genitalia. Guys, on the other hand, chancroid, it is seen with the agent Haemophilus ducreyi. It's seen with Haemophilus ducreyi. And I asked you to remember it like this. It has a D for ducreyi. And guys, the patients do cry because it is painful. Patients do cry because it is painful lesion. That's about chancroid. Condyloma acuminata is seen by human papilloma virus serotypes like 6 and 11. That is condyloma acuminata. Condyloma lata is seen in syphilis. Condyloma lata is seen in the secondary stage of syphilis. And lastly, doctors, beefy red ulcer. Beefy red ulcer is a characteristic of Klebsiella granulomatis that causes donovanosis. The one with Donovan bodies, bipolar staining and all that, right? That is beefy red ulcer, Klebsiella granulomatis. So the correct answer for this question here would be chancre, because the agent shown is Treponema pallidum, the agent that causes syphilis. Identify the virus labeled as B. So guys, this one, what you have to understand, this is a naked virus or also called as non-enveloped virus. And how do you know that this is a naked virus? It just contains two things. This purple thing, what you are seeing over here, it is the nucleo part. Nucleo means either the DNA or RNA. And then the protein coat that surrounds this, it is known as capsid. Okay, so any virus, whether naked or enveloped, has to be made of nucleocapsid. If you see the virus B, you have the entire nucleocapsid area here also. That means entirely you can see over here, nucleocapsid is present here also. But in addition, it is having one extra layer. That means this is the enveloped virus. The second one is the enveloped virus. Now what you need to remember is, technically by our logic we think that enveloped viruses should be more resistant ones, but that's not how it is. Enveloped viruses are actually more sensitive, whereas the naked viruses are more resistant. We can take alcohol as an example. The virus which is resistant to alcohol is naked virus, and envelope virus is sensitive to alcohol. And alcohol comes under lowest level of disinfectants. We know we divide the disinfectants into low level, medium or intermediate, and then high level. Even a low level disinfectant like alcohol can kill a enveloped virus. They're very, very sensitive viruses. Naked is quite resistant. So the question is now asking, what is B, right? So B means the question is asking you which of this is a enveloped virus. The answer to this is HIV. In fact, we know, right, the envelope of this virus comes from the gene called as ENV gene, which gives rise to two proteins, GP120 and GP41, glycoprotein 120 and 41. So this is a envelope virus. Remaining all are naked viruses. This is a simple question. All of the following are APCs except. These are the professional APCs. The correct answer to this question would be option C. That means B cells, macrophages as well as dendritic cells, all of them are professional APCs. That means if we imagine this cell is a antigen presenting cell, APC, antigen presenting cell presents the antigen to someone called as T cell. So T cell is not a antigen presenting cell, it receives the antigens. And if you guys recall, how do the antigen presenting cells present the antigen to the T cell? With the help of something called as MHC class 2, MHC or HLA class 2. That's how they're going to present this antigen. Okay, so B cells, macrophages and dendritic cells, all these are considered as APCs, antigen presenting cells. All right, dear friends. Which of the following processes occurs by a bacteriophage? Transformation, transduction, transcription, conjugation. Transformation, transduction, transcription and conjugation. All right, dear friends. What we should know here, let us discuss. The correct answer, first of all, for this, it is going to be transduction. Okay, this is the correct answer. Option B, transduction is the correct answer here. Now, first of all, what exactly is transformation? Transformation is the uptake of free or naked, genome or DNA from the environment. That means suppose there is bacteria number 1 that have died. It has released its genome over here. The bacteria number 2, it is going to pick up this thing from here. After the bacteria number 1 has died, it has released the genome, right? So bacteria number 2 can pick this up. And this is going to lead to some changes in the bacteria number 2. This is seen especially with streptococci. And who was the scientist that was associated with this thing? Griffith. Okay, Griffith was the one that has identified this. All right. Next, transduction is, there are two bacteria again, we can say. Bacteria number 1, bacteria number 2. So first of all, a virus will affect the bacteria number 1. This virus is known as bacteriophage because it affects the bacteria. The name is bacteriophage. After affecting the bacteria number 1, this virus will now go to the bacteria number 2. So it will bring some changes from the bacteria number 1 to 2. So what is going to happen now? Some changes will happen in number 2 over here. Is that clear? So this process is known as transduction, and the cycle of bacteriophage that is seen here is known as lysogenic cycle. So in the lysogenic cycle, this guy, bacteriophage, is doing this, transduction thing. All right. Next, transcription has no relation here. You understand what exactly is transcription? Formation of mRNA from DNA is called as transcription. And finally, conjugation. There are two bacteria that will come together. There is formation of something called as conjugation tube, right? And through this conjugation tube, the exchange of genetic material will happen. This is known as conjugation. All right. So this is it. This is about this method. Again, this was the correct answer since they had asked about bacteriophage. Okay, let me draw a border so that you know this is where you got to look. So identify this organism. See, if I didn't draw that border, right, the entire slide would look like India ink stain. So this is India ink stain that you know about, right? This is used for the identification of capsules. Especially you should know it for Cryptococcus neoformans, the agent that causes meningitis in AIDS. It comes at a CD4 count of 200. around the CD4 count of 200, you can expect Cryptococcus neoformans. All right, guys, India ink staining, you all know about this. Okay. Next. Slap cheek sign is seen in. All right, guys, the correct answer to this question, it would be Parvo virus B19. Okay, we all know this is a virus which is kind of different from the other DNA viruses. How is it different? You all know that this is a single-stranded DNA virus, speciality of this dude. Next, it is the smallest virus and it is a naked virus. These are the properties of this virus, parvovirus B19. The diseases that are caused, you all know that it causes fifth disease or erythema infectiosum. I've asked you to remember, you slap by 5 fingers, right? You slap by 5 fingers, so it causes fifth disease. That is why it gives you that slap cheek appearance. And if somebody has an existing anemia like sickle cell anemia, it is going to give something by the name of, okay, aplastic crisis. Okay. So this is it, my dear friends. This was just a way to connect with you guys again. And hopefully you guys are in good spirits. Okay. Let us stay depolarized and not get hyperpolarized or repolarized at this stage of time. Okay. You all know the difficult time if you are going like this. This is the difficult time you are in right now. You know the next thing is going to be like this, downhill. That means the good time is coming. All right. So we are going to take this exam head on. Remember, stay confident. You know enough. If you know micro, then I can assess that you guys are doing very well in other subjects also. Okay. So thank you very much for joining me in this session. It was wonderful, right, to have the interaction over here. It was amazing again, I would say. So wishing you all the very best from the bottom of my heart. I really will pray that you guys crack this exam on the 12th in this very attempt. We won't care whatever the number of attempts this is, right? This is our last attempt. This is how we are going to take this exam. All right. So as I told you, you're like Spartans right now, just preparing for this and we are going to win. All right. So that's it from me. Take care, everybody. Don't waste any time. Keep revising and hopefully I'll be hearing the good news from you guys. Thank you very much.